Hiya, I'm Rachel Skews and I work as a urology nurse practitioner. I look after male and female patients with incontinence and sexual dysfunction issues. I've been interested in urology for a long time, since I was a student nurse looking after old boys and their bleeding prostates, and literally fell in love with urology at that point. I've done a variety of other jobs, but I've always led back to urology. I'm part of the education team in the British Association of Urological Nurses, and that's great fun and lots of education with that. I've done a recent master's in urology. I'm a nurse prescriber, and I'm also an advanced nurse practitioner. So I sort of cover all eventualities and tick every box, I think. So a lot of men don't seek treatment for incontinence because most and foremost they are embarrassed about what's going on. Even men that have had radical prostatectomies, who are amazing that they're alive. They're embarrassed, they don't want to talk about it. And it's a bit like sexual dysfunction. Men just don't want to talk about it. I wish they would, though, because you'll be able to meet people like me who can sort you out very, very quickly in a relaxed, happy, nurturing environment. So, an artificial urinary sphincter is a genius device. It's a three-piece device, basically, to hold the urine back. There's a reservoir in the lower abdomen, there's a pump in the scrotum, and there's a cuff around the urethra. It's a completely concealable device, easy to use, and basically makes you dry. I think they're right to be worried, and that's really important that they are honest enough to be worried about it. And I think it's really important that they speak to the people that they love and write down lots of questions and queries, anything, even if they think it's daft, write it down. And when you meet up with your specialist nurse, discuss all those questions and queries with them. And because we can generally reassure you. And if it is something that particularly does bother them, and it's something that we don't know the answer to, then with lots and lots of forums that us nurses are on, and we can talk to other specialist nurses and even company reps who will be able to support us with the answers to your questions. So most of the time the feedback is unbelievable. I get lots of tears, lots of laughter, lots of hugs, but it's really wonderful. The majority of men are very, very happy, and even those that unfortunately have to have the operation revised are understanding. They can go swimming with their grandchildren, they can play golf with their friends, they can sit down to dinner with their friends and their family, they can go on holiday without worrying about being incontinent and not having to wear huge pads. It's life-changing. So all men out there should not be embarrassed about what's going on with them. If you've got any erection problems, if you've got any bladder problems, you need to speak to your GP and get referral into a specialist centre. There is something that we can do for all of you. Do not be embarrassed. Do not think that it's only you that's having this problem. Men don't talk about it in the pub. You all think that this is just you, but I believe me, there is a lot of you that have got these problems. And if you don't want to speak to your mates or your wife or your other family members, come in and speak to me. There is a lot of professionals all the way around the UK, just like me, who will be able to support you through your problems and try and make your problems better. Can we make them perfect? Not necessarily, but we along with you can improve the situation that you're in. There are lots of men out there that are suffering in silence with both their erections and or in their incontinence. And they suffer in silence. They don't talk about it in the pub. They don't talk with their family. They don't talk to their friends, and they think it's just them. But it's not just them. There's a lot of men out there struggling with these problems. And all you have to do is speak to your GP and get referral onto a specialist centre where you can speak to someone like me who will be able to help you with your problems. It may be that you have surgical or medicine or just chatting. There's lots of things that we can do, and don't be embarrassed, don't be worried. This is what we do, and we are here to support you.